give another moment for a few people I see coming in to be able to find a seat. Before I start, I want to apologize. It's really warm. The air conditioning broke today at the school. We had a meeting about it this morning, but it was obviously too late to get out the word that we would change to a different location. So we have some fans up just to try to circulate some of the air. So we apologize. Thankfully, it wasn't a particularly hot day. But certainly if people feel it's much cooler by the fan, so if you're feeling overheated, if you want to step out to any of the spots where the fans are for a moment, it's definitely a lot more refreshing. Okay, so I think we'll get started. Good evening. My name is Megan English-Braga, and I'm the chair of the Board of Selectmen here in Falmouth. I'd like to thank you all for being here and welcome you to tonight to our forum on treatment facility and sober houses. This forum really grew out of an ongoing conversation that's been going on throughout our community, on many levels of our community, with questions and concerns that we have surrounding the proliferation of sober houses, the placement of treatment facilities, and some of the other services that folks have been having conversations about. There has unfortunately been a lot of misinformation and really an absence of facts in this arena. And so the board decided we recognize that we don't have all of the answers. We didn't have all of the information in order to answer some of the questions that we were being asked. And so with the assistant of the town manager, Julian Suso, and assistant town manager, Peter Johnson-Staub, we've brought here tonight the Southeast Regional Manager of the Bureau of Substance Addiction Services from Massachusetts Department of Health, Derek Meehan, who's here, as well as the Executive Director of the Massachusetts Alliance for Sober Housing, Larissa Matzek, who's here. We thank you for joining us. We hope that they'll be able to answer some of our questions. We're also pleased to have a number of our elected officials here tonight. I see David Vieira here. And I believe that Dylan Fernandez and State Senator Vinnie DiMacedo were planning on being here tonight. I know we started right at 6 o'clock, so I'm sure they're going to be. Sure they're going to be arriving. And we hope that they'll be able to answer any questions people have about what's happening at a legislative level, and more importantly, that they'll be able to take back our comments and our concerns to the State House. We have a number of individuals who are members of the Falmouth Commission on Substance Use that are present here tonight, and I think they'll make a few statements. And that commission really is the group of people from our community that are charged with really focusing on a lot of these issues and making, really advising the Board of Selectmen. So they're here tonight. They'll talk a little bit about what they're focused on and some of the services that or some of the work they're going to be doing in the future. We also have a number of individuals from the town here. Several that are going to speak are our Falmouth Human Services Director, Susie Hopman, Falmouth Health Department Director, Scott McGann, Falmouth Chief of Police, Edward Dunn, Fire Chief Mike Smalls, and Falmouth Town Council Frank Duffy. On behalf of the board, I want to thank all of you for being here, for making yourself available to answer questions. Finally, I think that there are some members from Gosnold that are here, some representatives tonight, to hopefully take some comments and perhaps answer some questions. We had received in advance a lot of questions that really focused on Gosnold, so we thought it would be helpful if someone was able to be here to perhaps answer questions the community might have. Before we get started, I just want to go over the format for tonight. The agenda was made available in advance, but for anyone who was unable to see it, I just want to be clear that the focus of tonight's event was for it to be a question and answer session. You'll see from the agenda that's posted that out of the 2 hours, we've reserved an hour and a half for question and answers. We've put a very small portion in the beginning, half an hour, where we'll get some comments and some information from the individuals that you see listed here as some of our speakers, but it's a very short period of time that we've asked for them to put some information together. And what we understand is that through the questions that you ask, they'll be able to share additional thoughts, additional facts, additional information. The Board of Selectmen did in fact call for questions in advance, and I do have some of those, and we'll start with those after the presentation. We'll do that for about, I think, is it half an hour? And then what we'll do is we'll launch into questions from those of you who made it a priority to be here tonight. If at the end of that period there's more time to go back to some of the questions we got in advance, I will do so. A lot of the questions were really similar, but I will start with those. Once I'm done with the opening remarks, Frank Duffy is going to come up. He's going to make his presentation. When all of those individuals have finished making their presentations, we'll sit here up at the table. We can't do so in advance because it will block your view of any PowerPoint presentations that you're going to see. So the individuals that I noted will be here in order to direct your questions and your comments too. What we'll do is once the presentations have stopped, there are 2 microphones, one on either side of the stage, and folks can line up. Each individual is going to have 3 minutes to ask their question or make their comment, and that way it allows time for everyone to be able to get up, ask a question, and certainly you can get back in line again. That's not a problem. But we want to make sure that everybody who wants to ask a question gets a chance to do so. Peter Johnson-Staub he's going to be the timekeeper. He drew the short straw, so he's forced to do that tonight. He's going to raise the yellow card when our speakers or individuals have 30 seconds left, and then the red card when they're done. I hope that you'll honor it. It's a system that we've borrowed from the League of Women Voters. They run very efficient and really organized meetings. We hope that same system will work for us. And again, the goal is to make sure that everybody here gets to ask a question if they want to. Okay? Lastly, the goal of tonight. Sorry. Oh. I'll be really fast. The goal, Frank Duffy told us that he was colorblind. I don't know if it's true, but I think he was setting himself up to just be able to keep going. So we'll see. I'm going to plead Frank's case. The goal tonight is just twofold. One, to get enough information out there as possible for individuals from the state who have come here to answer those questions, from town council, from staff here from the town. And the second piece really is to have those individuals, both here at the town level, but particularly our elected representatives and the representatives from state agencies, to hear from us, to hear our concerns, answer some of our questions, and bring that back so that they understand what our community is concerned about. Just want to thank the school for allowing us to do this tonight, particularly Ryan Weber for his IT assistance. We really appreciate it. And without further delay, Frank, if you want to come on up, please.
I want to thank everybody for coming here tonight. I have a brief overview of how government regulates sober houses. Now, there are 3 levels of government that regulate with laws and policies as to how sober houses exist in your community. Of course, that's the federal, state, and local government. And I'll briefly discuss how each level of government regulates sober houses. So let's start, if we may, with the federal government. The United States government generally supportive of sober houses in our communities. The principal statute is known as the Fair Housing Act. It is administered by the Department of Housing and Urban Development. And the act provides that recovering alcoholics and drug-dependent persons are disabled persons within the meaning of the act. So there's a disability here. The act provides that recovering alcoholic and drug-dependent persons are disabled, and local communities may not use local bylaws to discriminate against disabled persons in housing matters. We're talking about sober houses. And they must grant them reasonable accommodations or exemptions from the local zoning bylaws and other acts which impact them in a discriminatory manner. Now, Falmouth has some direct experience with the Department of Housing and Urban Development with respect to the enforcement of the Federal Fair Housing Act. In 2002, which is a number of years ago now, there were two sober houses that opened for business at 49 and 53 Lakeshore Drive in the Pinecrest Beach section of town. There were complaints from the neighbors. The building inspector at the time went out and inspected the properties and determined that the sober houses violated the Falmouth zoning bylaw. They did that because in a single residential district, single residential family district, each property was occupied by more than 4 unrelated individuals. And at the time, the definition of a family stopped at 4 unrelated individuals. The owner of the properties, and it was one owner who owned both properties, filed a complaint with the Department of Housing and Urban Development. HUD sent to Falmouth an investigator and a conciliator. The investigator did his investigation and determined that there was a violation of the Federal Fair Housing Act. The conciliator then stepped in and negotiated a settlement, which I'm going to review with you in just a moment. The settlement was documented in an enforcement agreement, which was signed by all of the parties, and it provides 3 things. First, in the case of sober houses, the town will grant an exemption from the zoning bylaw restricting a family to no more than 4 unrelated persons in a single residence. This was an agreed upon, a reasonable accommodation for the disabled people. That agreement allowed 14 residents in each of the sober houses, and that was based upon the number of bedrooms. There were 7 bedrooms, I believe, in each house. Now, the reasonable accommodation for the number of residents in a sober house is not a fixed number, but it's based upon the number of bedrooms. And finally, the owner agreed to comply with all building, fire, and safety codes existent at the time and in the future. This enforcement agreement remains a viable document. It hasn't been really pulled out from the file in about 15 or 16 years, but it's there, and it still binds the town. So we are required under the Federal Fair Housing Act to grant reasonable accommodation or exemptions from zoning bylaws which impact in a discriminatory way people with disabilities. The second level of government that deals with sober houses is the state government. And the Commonwealth of Massachusetts basically follows the federal laws as they relate to sober houses. Now, one of the important elements of state law and local law is the zoning bylaw of each city or town. There's a State Zoning Enabling Act, identified as Chapter 40A of the general laws, and in it there is a specific provision with respect to sober houses, although it doesn't use that word. It provides that a city or town may not use local land use zoning bylaws or health and safety codes to discriminate against congregate housing arrangements of disabled persons. So what this effectively means is that a city or town cannot arrange its local zoning bylaws or its health or safety laws in a way to zone out or exclude sober houses. And that's, of course, any place where disabled people live in a congregate arrangement. Now, we cannot use local bylaws for that, but in a recent case in Worcester County, the city of Fitchburg applied a state law with respect to automatic sprinklers in sober houses, which also qualified as lodging houses in that city. The owners objected, the case went to trial in Superior Court in Worcester, and the judge ruled that the city of Fitchburg could apply state health and safety laws with respect to sober houses. Now, there's one difference, and I'm going to point this out because I think Chief Small is going to talk about it a little bit later. But there is a provision in the general laws, Chapter 148, Section 32I, I believe it is, that mandates automatic sprinklers in lodging houses. It's a local acceptance statute. Fitchburg accepted it. Falmouth has never done it. If it were to be accepted in Falmouth, we could apply it in Falmouth. It has not been. That's just something for further consideration. But they did say that the city of Fitchburg could apply state law. Finally, there's just 2 more points, Peter, and then you can wave your red flag, okay? The state has created a program what is voluntary certification of sober houses, and you will hear about that tonight. It does distinguish between certified and uncertified sober houses. Now, certification is a voluntary program. The state of Massachusetts does prefer certified sober houses, and they require that any patient discharged from a state institution or a state-sponsored facility be directed or referred to a certified sober house for follow-up treatment, although this does allow uncertified facilities to continue to exist. Now, with respect to the Falmouth zoning bylaw, there's not much in it with respect to sober houses. In fact, the term is not defined in the bylaw, and there's no classification of sober houses in the bylaw. This is really kind of in conforming to the restraints of the Federal Fair Housing Act. But in 2002, after we signed that enforcement agreement, the town did change its definition of a family in the zoning bylaw. And there is now a provision in the zoning bylaw defining a family as, it's one of the definitions of family, but a group of unrelated individuals determined to be handicapped by the building commissioner under the Federal Fair Housing Act, state law, or this bylaw, residing cooperatively in one dwelling unit, up to 5 individuals, or at a density of no more than 2 individuals per bedroom, whichever is greater. So our bylaw allows in the sober housing situation a maximum density of 2 per bedroom. Finally, the Board of Health does require or request that sober houses be registered, and they will inspect them upon complaints. So that's the substance of my remarks about the overview of regulation, and I'm going to bring up the next speaker.
Thank you very much, Frank. Derek? Thanks, Frank. Derek, if you want to come on up. Derek Meehan is the Southeast Regional Manager for the Bureau of Substance Addiction Services. And if I could just ask for our other speakers are going to speak, if maybe you just sort of come a little bit closer. If you're far down, that way the transition will be faster.
I think, well, I want to say good evening, everybody. Thank you for having me here tonight. And thank you, Frank, because I think that was a good segue into the state's role when it comes into our view on sober housing. So I just want to say, sober houses are they're private residences that provide an alcohol and drug-free environment for people who are in recovery from a substance use disorder. Also, sober homes help individuals to work and learn while rooted in a recovery-oriented community. Sober homes do not provide treatment. They are not treatment facilities. Therefore, they are not licensed or regulated by the Bureau of Substance Addiction Services. Occupants of sober homes are considered a protected class by the Fair Housing Act of 1934, and we heard about that from Frank. I want to talk a little bit about the need for standardized certification process. We know that Massachusetts has been home to many sober homes for a very long time. However, the quality of these homes has been inconsistent. In recent years, consumers, including lack of attention to health and safety issues, have had some concerns. In 2010, the Massachusetts legislature directed the Department of Public Health, Bureau of Substance Addiction Services, to conduct a study on sober housing, which particularly looked into the quantity of sober homes in the state, as well as the impact of sober homes on neighborhoods and communities. Now I want to just talk a little bit about the law. As provided by the law, the certification process must be voluntary. It must follow national standards, including training, ensuring safety, healthy and effective recovery environments, as well as protecting occupants from the unreasonable and unfair practices in settings and with regards to rent payment. So through the certification, vendor DPH BSAS must make available to the public a list of certified sober houses that update bi-monthly the certification standards and the process for filing grievances. So to become certified, a person seeking certification must prove that they are the lawful owners or lessees of the applicant's sober house and that the house has no taxes or other assessments that constitute liens against the property. And state agencies and vendors with state contracts, as this was mentioned earlier, they must refer only to certified sober houses by law. Lastly, I just want to share a couple of figures with everyone. So it was September 2016 that the Department of Public Health established through regulation that all state licensed programs must only refer to certified sober houses. And sober houses are certified annually, or recertified annually, I should say. As of Friday, June 7th, there were 2,594 beds in 186 certified sober houses in the state of Massachusetts. Of those sober houses, there are 133 beds in 17 homes that are actually certified in Falmouth, which includes Falmouth, West Falmouth, and East Falmouth. And as a result of grievances filed or owners deciding not to recertify, 29 sober houses that were previously certified are now decertified. And some of the mandatory trainings that are required of certified sober houses include education about medication-assisted treatment and Mass Health rules regarding fraudulent practices on billing for drug testing. So that's what I have right now. I look forward to your questions later, and again, thank you for having me.
Thank you, Derek. Next, if I could ask up Larissa Matzek from the Massachusetts Alliance for Sober Housing, the Executive Director.
Hi, thanks for having me here tonight. A lot of my presentation has already been given, so I'm going to try not to repeat everything that's already been said. I'm from the Massachusetts Alliance for Sober Housing, also known as MASH. We're a nonprofit organization with a contract to manage the voluntary certification process of sober homes in the Commonwealth. As Derek said, we currently have 186 certified sober homes, 17 of which are in Falmouth. We update those numbers weekly, and if there are issues with homes, significant issues, there are houses that do come off the list. One of the big reasons that the Mass Sober Homes Law came into effect was for transparency, and it's also been known as a consumer protection law. One of the things we do at MASH is we manage the certification process. We do these annual inspections, and we also do inspections when there's a grievance. We have a grievance process. It's a big part of what MASH does. Any resident can file a grievance against a house. A neighbor can file a grievance against a house. Any person who wants to do that is able to do that. We only investigate grievances on certified sober homes, although we do collect limited data on homes that are not certified. We have a thorough application process based on national standards. There are a number of standards all homes must meet. Applying for certification does not mean you will pass for certification. It is a fairly rigorous process with standards that are Massachusetts standards that were adapted from the National Alliance for Recovery Residences standards. I think that's really all I have to say right now, because a lot of what I would have talked about with the laws and all of that were already talked about tonight, but I'm happy to answer questions. Thanks.
Thank you. And now Susie Hutman's going to give us some information from her department, Human Services.
I'd like to share a bit of what our department does in support of residents impacted by substance use-related issues. The Human Service Department serves as a hub for residents when they are in search of social services of any kind. We're here for residents to provide information on where they or a loved one can find substance use-related resources. Residents can call us when they're unsure of where to turn for treatment, counseling, family support, medical care, and the like. Often, a resident is in need of more than just a phone number or a contact name. Our social workers can offer personalized support and guidance over the phone, or we can offer same-day appointments to assist in identifying the next steps or to be a sounding board to assess or whatever the situation that is presented. We can assist in making personalized connections with local and regional resources. Understanding and navigating these resources can be very overwhelming, and when an individual or an affected family member is in distress or is just completely unsure of where to turn, the supportive role of one of our staff social workers can be of great benefit. When we have a resident that is in need of counseling and is uninsured or underinsured, or for some other reason is unable to access services, the department's clinical social workers can provide short-term counseling. This is to serve as a safety net and a bridge for longer-term or more specialized services for any Falmouth resident in need of counseling. We maintain really strong community partnerships and representation on regional committees and liaison to the Falmouth Commission on Substance Use. As part of our daily work, the department stays very connected to local providers, program leaders, advocates, and stakeholders in the mental health and substance use field. In order for us to ensure that Falmouth residents have access to all that is available in the region, we take care to foster these professional networks and relationships to benefit the overall good of the community. Through our department and the Commission on Substance Use, Falmouth is represented on the Barnstable County Regional Substance Use Council. The purpose of the council is to establish a coordinated and comprehensive regional approach to substance use issues across a continuum of prevention, harm reduction, treatment, and recovery. The Recovery Working Group of the Regional Council is focusing its efforts on the issue of recovery housing on Cape Cod. I believe many members of that group are here tonight. The Falmouth Substance Use Commission has aligned their work plan with that of the RSAC so as to maximize these collaborative efforts that address the impacts of substance use disorder on Cape Cod and specifically here in Falmouth. A great deal of the prevention resources, data analysis, publications that we use are from the Regional Substance Use Council and are used in our local efforts when working with the school department, police, fire, health department, as well as disseminating to local medical offices and the business community. The Human Services Department role is that of a support to our local residents impacted by substance use disorder. We recognize the role that quality recovery housing plays in the successful outcomes for folks in early recovery. We see and hear the concerns from residents who are impacted by those houses that are not operating under best practices, and the department's committed to remaining involved in the process. So thank you everyone for being here.
Scott McGann, Falmouth Health Department Director.
Good evening. You want to go to the first slide? A little bit about regulations, and I broke it down into treatment facilities and sober homes. Treatment facilities are licensed by the state. The only license that the health department issues is their annual food permit. So they get an annual food service permit from us. Much like with hospitals, assisted living facilities, that's the only license that we issue for treatment facilities. In terms of sober homes are defined as rooming houses. They fall under the same regulations, which is the state housing code, as any other type of rental property or single-family dwelling. So we apply the same code regardless of the type of residence that it is. Okay? The housing code's primary function is the health and safety of the tenant. As Frank stated, the Falmouth does have a bylaw requiring that all rental properties register with the health department. Next slide. Inspections. That food service permit means twice an annual inspection, which is true of any food service establishment, minimum of twice a year. In terms of sober homes, like with any other housing, okay, per the state housing code, an inspection is performed upon request of a tenant. We don't currently do routine inspections, and I'll explain why later, of all known rentals. So typically within 24 to 48 hours at a request of a tenant, we're out doing a housing inspection, okay? We also visit rental properties based on a neighbor complaint. However, it's generally an exterior inspection because without a warrant or invitee invited in by the tenant, we can't gain access inside the dwelling. So we would do an exterior inspection. The health department's also exploring a more robust housing program at this point, which means finding the rentals, registering the rentals, and inspecting the rentals. But that is a ton of labor, and at this point in time and effort, and we haven't gotten to the point where we have staff to do solely just housing. So we do housing right now based on upon request. Occupancy. Sober homes, as with any other home, use the rental bylaw, 2 per person, provided that each additional occupancy can be provided as allowed upon Article 2 of the Sanitary Code, may be allowed based on going out with a tape measure and actually measuring the bedrooms and measuring that, and that's the only way that occupancy would ever get beyond 2 per bedroom. Okay, and that is from, that rental bylaw is actually as written. Okay. The next is septic systems. We've had some questions about septic systems. Sober homes, as with any other type of single-family, multifamily, motels and hotels, fall under the 110 gallons per day. So that same applies whether it's to be a sober home or a single-family dwelling. It's 110 gallons per bedroom per day. Septic systems are replaced when they fail. Hopefully nobody that happens with any of y'all. Or if they're asking for an increase in the number of bedrooms, that generally will mean a new septic system, an upgraded septic system. So currently their septic system, if they have 5 bedrooms, they have a 5-bedroom septic system. It's not failing, it's not an issue. So that's what I have. Thanks.
And if I could have Chief Dunn come up, please? And then the last person we'll hear from is Chief Small.
Thank you. Thanks for everybody being here tonight. What I'm going to be providing you with is some real data that the police department has, because I've heard from different people that we have a lot of overdoses at sober homes. So I really want to break it down for you as to what we actually have. The bar chart that you have up here, if we start at the far end down there, you'll see back when this whole epidemic started around 2013, we had a total of 28 overdoses. 2014, we had 76 overdoses. At that time, we weren't tracking where they were, we were just tracking the overdose itself. 2015, we started tracking the ones that were occurring in sober homes. And as you can see from the chart, we had 121 overdoses through the community, 6 were in sober homes for a total of 127 overdoses. 2016, it went up to 148, 13 of them were in sober homes. 2017, 144, 18 in sober homes. 2018, 103 overdoses, 11 of them in sober homes. And then to date, this is as of this morning, we've had 59 overdoses and 8 of them have occurred in sober homes. These are the police responses to sober houses and facilities for treatment. As you can see, all the sober homes, we've broken it down, and this is from 2016 to present. We've responded to sober homes 397 times. That other category is property crimes, overdoses, domestics, anything you can think of. Then we broke it down into the actual treatment facilities. We have Recovering Champions. We responded there 92 times. Gosnell Treatment Center, 253 times. Emerson House, 0. And the Miller House, 15 times. But the bottom number down there, I don't know if that table is blocking it. We've also tracked all the calls for services in the town of Falmouth during that same period, and that's 113,961 calls for service. So, be happy to answer some questions later on you may have. Thank you.
And Fire Chief Mike Small, if you want to come up.
Again, I only have a couple of quick slides. I won't take 3 minutes. I just have some response statistics to, in Falmouth, my data goes back to 2016. Total fire department responses, 200 Terhune Drive, which is Gosnold, since January 1st, 2016 to date, 748. 165 Woods Hole Road, which is the Miller House, 32. 564 West Falmouth Highway, which is the Emerson House, 24, and then 279 Brick Hill Road, which is Recovering Champions, 30. This data goes back to 2016. Lastly, of the responses to known sober houses in Falmouth since 2016, that number is 170. I do have some more information about what Frank talked about Chapter 148. When it was a question that came up, some of the questions that were sent in, and I'll be happy to address that then.
Thank you, Chief. Great, so we're actually only 2 minutes beyond where we should be. So if I can ask our guests that have their name up here to come on up, this is when we're going to start opening up the session to some questions. I'm going to start with the ones that were sent in. And I'm going to just note the people who sent them in case they're here and they end up having a follow-up question. So I'll just give our guests a moment to get up there. Hey, guys. And then whomever believes that they should respond to the question, please just jump right in. We'll keep the back and forth with questions a little bit informal with this panel. Oh, I stole the chair. I'm sorry. Sorry, Vinny. No worries. Okay, so let me get started. We had a question from Jamie Sylvia, and the question was, who's tracking the number of overdoses in Falmouth? Some of this is a little bit from what we've seen for some of the slides. How many at sober homes? We saw that. How many by temporary residents of sober homes? And I guess maybe what we haven't heard yet is how many are actual Falmouth full-time residents and not just residents because they've moved into a sober home? And then the last piece, this question looks like it's probably best for maybe the two chiefs to answer. But any idea, I know you don't have exact numbers, but any idea to be able to compare sort of the cost of these responses to maybe the cost or maybe the volume of calls overall by your departments, if you can just speak to that again a bit.
The short answer for me is I really would have no idea how to calculate the cost of a call. I don't know if there's any formula out there.
I think you have to put it up really.
So the short answer is that I would really have no idea how to calculate the cost of one particular call. I mean, we know that Narcan's about $45 a dose. All of the Narcan that the police and fire use in Falmouth is provided through a grant from DPH, the Commonwealth of Massachusetts. But as far as assigning a cost to that, I wouldn't even know where to begin to assign a cost.
And Chief, if you could just, either one of you, speak to just a general sense of whether or not you know the people you're responding to are, the designation this individual is asking is full-time Falmouth residents.
Again, we have no way of knowing that.
Thank you. Chief Dunn?
As far as the cost, again, it's really difficult to calculate that. It's like handling any other call. But what I can give you is, as Chief Small said, I can give you some factual numbers from the grants, what it's cost in Narcan. 2016, we received a $15,000 grant. 2017, we received $17,666 grant. 2018, we received $18,000 grant. 2019, we received $14,500 grant for a total of $64,566. And as he says, that money is coming from the state that we get by our Narcan with. And as far as whether we're responding to a resident or non-resident, we don't know that until we get there, and we don't ask for identification for everybody in the home unless there was another investigation of some sort. So no way of really knowing.
Thank you. We have a question from Cheryl Craven. If we could please ask state officials why sober houses are under the ADA and why there is very little regulation. So maybe if someone could just touch upon that again. I know we heard that a bit in our introduction.
Hello. Yeah, I want to say it's by law, and the reason why they're not under regulation as other treatment facilities are is they're not viewed as treatment facilities, it's viewed as housing. So even though on an individualized basis, many people that are reside in a sober home could benefit and should benefit from treatment, it's not an expectation like what we would see in a residential setting or an inpatient setting.
We have a question from Gail McRae. My question is the role of the fire department in approving fire safety in sober houses. Recently, I'm just going to add in, I read an article of the opening of sober house in Ashmont section of Dorchester. The fire department required sprinkle system, application withdrawn. Have been in sober homes, wood structures, several in bedroom, no fire exits noted, ropes by windows not noted. Therefore, the question is a fire safety issue and requirements by the fire department. So I guess in general, what is the fire department's role?
So this is what Attorney Duffy alluded to earlier. Currently, in Massachusetts, sober homes are considered single-family dwellings. We have no inspectional authority, we have no, basically, other than to ensure that there are smoke detectors and carbon monoxide detectors upon resale, other than that, they're treated as single-family dwellings. What Attorney Duffy was referring to is a recent, and to answer this question, the City of Boston has accepted the provisions of Chapter 148, 26H, which is, like Attorney Duffy mentioned, the fire chief can then mandate the installation of automatic sprinkler systems if the town were to choose to accept that. My understanding is it would be a town meeting vote. If the town were to accept the provisions of 148, 26H, then that sprinkler regulation would apply to every dwelling in Falmouth that meets that criteria, including inns, bed and breakfasts, and potentially even, if you were to Airbnb your home. Falmouth has not accepted that regulation. My understanding is that the City of Boston has, and that's why when the City of Boston was going to apply that, that's why the application was withdrawn.
Thank you. Go ahead, Frank.
The Section 26H is what's called local acceptance statute. That means that any city or town can accept it or can ignore it and not accept it. It's a town meeting vote, it's a majority vote. We have accepted many statutes over the years. This one I don't think has ever been presented to town meeting. Maybe somebody would want to do it. But as the chief pointed out, it would apply not just to sober houses, but to a lot of other category of buildings, and there might be some people in favor of it and some people opposed to it, but that's a question we'll probably leave to town meeting at some point.
Thank you, Frank. Chief?
Just one more point. This issue has been litigated in court on several occasions, once in the city of Brockton, where the Brockton Fire Department did not prevail. Most recently, what Attorney Duffy referred to was the beginning of this year in the city of Fitchburg, where the city of Fitchburg did prevail. I've already communicated back and forth with Attorney Duffy on this issue. I don't want to speak for him, but I believe, from what I read, this is far from being a settled law.
That's true. The case was decided in January in Superior Court. I'm not sure whether it's been appealed or not, but if it has been, it'll probably take a year for the appellate court to decide. And I'm also somewhat concerned about the fact that the court specifically didn't answer the question about whether the Federal Fair Housing Act applied. So this whole area of law is unsettled.
Great. Thank you. A question just in general about, this is from Albert Johnson. His question is about why Falmouth should, sober houses in Falmouth should be governed the same as hotels, inns, rooming houses, private homes, and apartment buildings. They should have to comply with septic regulations, capacity, the same as everyone else. So maybe, Scott, if you could just address that piece one more time as to whether or not that's the case.
Again, it would still be based on 110 gallons per day per bedroom, regardless whether it's a sober home or a single-family home, so there's no extra capacity that needs to be built in. The 110 gallons per day assumes 2 people, and when Title V, the regulation that governs septic systems was written, it was assuming 2 per bedroom. So that's why it's 110 gallons per day per bedroom, 55 gallons a day per person. So a sober home would meet in similar to that.
A question from Brenda Swithenbank. Would non-certified sober houses fall under the short-term rentals tax law recently implemented in Massachusetts? If not, why? Okay. You just have to press the...
Hear me?
Yep.
Okay, so certified sober homes were exempt from the short-term rental tax. Non-certified sober homes are not exempt from the short-term rental tax. Pretty simple. So I suppose, when we talk about incentivizing sober homes to become certified, in 2016, the state ruling that providers could only refer people to sober homes that are certified, that was an incentive. Us not including non-certified sober homes in the exemption for the short-term rental tax is another incentivization for sober homes to get certified because they are subject to that short-term rental tax.
Great. Thank you. And just along something somewhat connected to that idea, this is back to Albert Johnson. He was wondering why these, sort of all the homes are not registered by the town so that the town will be able to keep track of incidents, et cetera. So maybe if someone could just speak again to the requirements of registering and being certified.
I mean, we have, you know, there are records on our website of all the certified homes, where they're located, how many beds are in each sober home, who the owner is, and what the contact information is. But we're not required to keep information on non-certified home. I'd have to defer to the town on if they keep any information on those homes.
Frank or Scott, could either one of you speak to?
Can I
to
just
that?
add something? I just want to add something.
Oh, please.
I just want to add, too, that this is viewed as a protected class, and that this is a voluntary process by law. So even though it's strongly advocated for, you know, and particularly, you know, where the treatment facilities, license-funded treatment facilities can only refer to the certified programs, again, it's very much a voluntary process.
Thank you, Derek. Can anyone from the town just answer that particular question about whether or not other homes that are not certified are required to be registered? I know we've heard that piece a bit, but it's a question that keeps being asked over and over again.
Well, the registration requirement must be one that's mandated by state law. Currently, it is not, so we have no authority to require registration.
Thank you, Frank. We have a few questions that came from, actually, Selectman Brown. And he was asking if, how do addiction service facilities determine placement of clients in sober homes? Does someone from the facility go to the prospective home to ensure that it is a safe environment? Is there any follow-up after placement? So I'm not sure if.
I can respond to that
Okay.
question. So in all of the treatment facilities, each client, patient, resident receives an individualized treatment plan. That's a plan that is established usually with the clinical staff, other members of the treatment team, and also, you know, really something that the client or resident of that program needs to be on board with the goals and the objectives of. So a resident who would be pursuing sober house placement, the program would then work on making that appropriate referral to a certified sober home. The other question that was brought up was if it was protocol for a program to send staff to a sober house to check that sober house out, or to make sure that it would be a good placement for the individual. Though it's not a requirement by the state, I believe, and we at the state believe, that it is a good process to have in place. It's a nice warm handoff, you know, to be able to assure that the individual that's being referred to this sober home gets there safely and is able to be integrated into the housing there with other services if necessary.
Thank you. Go ahead, Larissa, did you want to follow up?
So just to be clear, again, it is the law that all of these facilities have to refer clients to MASH certified sober homes, and we are in charge of the inspections for those homes, and so we are certifying that these homes are an appropriate place for people to be sent to. And that's the process, and MASH is the only recognized entity in the Commonwealth as being in charge of this inspections process for all of the certified homes.
Thank you. I had another question from Selectman Brown. Maybe either of the chiefs can speak to this. Is there a disproportionate number of emergency service calls to sober homes? It doesn't say in comparison to what, but I guess you understand sort of the general gist of the question.
So it's a very hard question to answer. And looking back over the last 3 years of data that we have for places that we know are sober homes, most of the responses are in the 1s and 2s. There are a couple of addresses where we've been to 7, 10, 11 times. Could you call that disproportionate? I don't know. There are other houses in Falmouth that we respond to 7, 10, 15 times over the last 3 years that aren't sober houses, that are probably non-sober houses, which is the problem. So it's hard to say what constitutes a proportionate response.
Thank you. Chief Dunn?
Yes, from the slide that I put up, I mean, if you total all the responses to the sober houses and to the treatment facilities, it totaled somewhere around 690, 700 calls for services in a 3.5-year period out of 113,000 calls. Again, is that disproportionate? We responded to Falmouth Hospital in that same period of time, 2,914 times.
Thank you. Just another general question that we had quite a few individuals submit on, if there's any sense of the number of sober homes in Falmouth, and if that's unusually high compared to any other communities. I know this doesn't necessarily fall into the purview of anyone in particular, but maybe Larissa or Derek could speak to it.
I can't speak to the uncertified sober homes, but I can say that as of yesterday, Falmouth, East Falmouth and West Falmouth had 17 houses, 175 beds within those 17 houses, 94 male, 81 female. This represents 20% of the beds in the southeast region. That's from Cape Cod and the islands up to Stoughton, Brockton area, and 6.8% of the total amount of beds statewide that are certified.
Great, thank you. I think what we'll do is we'll open it up to some questions from folks. If you want to just start to line up. Peter, could you just make sure the microphones are on? And what we'll do is we're just going to alternate from one side to the other, so it's just a fair process. So we'll start here with Beverly. So when you come up, if you'll just please state your name. If you are representing a particular organization, please note so.
Peter, is this one turned on? Okay. So I'm going to go. I hate to put my back to anybody, but my name is Beverly Costa Ciavola, and I'm the current chair of the Falmouth Commission on Substance Use. I've been with the commission for about, I think, almost 4 years now. And I just have a little statement that I want to read. I would like to give you an idea of the direction the commission has been going towards in the last year. The commission has been working on an action plan that the focus is on prevention education and quality recovery housing. In doing so, as Susie had said, we try to align ourselves with the work that's being done at the Barnstable County Regional Substance Use Commission. And the working groups. And those are the areas that some of those working groups are also tackling. It is our intention to improve communication with the recovery housing community and to support their efforts. We think this is very important. We recognize that we have quality recovery housing in Falmouth, and we hope that the town and its residents will support them in their efforts to provide for those in recovery. You know, not all of these people are people from out of town. Many of them are people that come from our town, right? And as an aside, I work with grandparents who are raising their grandchildren. And right now, 99% of them have their grandchildren because of substance use issues. And they would tell you that these are their daughters and sons, and they want them to have quality recovery housing. If you would like to know more about the commission and help us move forward with this important work, we meet the fourth Thursday of every month at the Gus Canty Rec Center upstairs, and we would be happy to have you join us. We believe it's important that all voices are heard, and we welcome the community input. Thank you.
Thanks, Bev. Go ahead, Mike. Oh. Well, actually, I'm just going to alternate, so it'll be Mike and then it'll be you.
Great, thank you. Michael Halen, Cliffwood Lane. Can I ask the panel questions through you?
Yeah, just ask your question, then whoever, yep, go ahead.
All right, perfect. So, Larissa, you're from MASH?
Yes,
And how long have you been working at MASH for?
This is my 4th month.
4th month. And who was in charge of MASH prior to you?
You mean who was the director?
Yes.
Troy Clarkson.
Okay, thank you very much.
You're welcome.
And then to you, Mr. Meehan, are you familiar with Costa Mesa, California?
Costa Mesa, California. I know where it is.
So Costa Mesa,
Yes.
California, they passed a zoning bylaw to limit the number of residents in a sober home for the safety of the residents. I believe it's at 6 with a full-time manager. So there are ways to zone sober homes to protect the residents of the sober homes, limit the amount of people in the sober home, make sure there's a full-time resident. Are you aware of this?
Yes.
Okay. And is that something that, according to the ADA guidelines, that's something that's legal? Because California went to the Superior Court and they passed that, so that was all well and good. So that could happen in Massachusetts?
Well, Mike, I just want to stop you because we can ask Frank to address that. That's like a very specific legal
Okay.
question about another state, because it went to the Superior Court. I know the case you and I have talked about.
Yep.
Went to the Superior Court in California. So to the extent that Frank can kind of address that general idea, I think he would be able to address it. Derek's not,
Okay.
the legal person on the board. So if you're asking if that's something, if the gist of your question is that something we can do,
I rescind my question to you, Mr. Meehan. Over to you, Mr. Duffy.
Zoning is very specific to each state. Massachusetts has a zoning enabling act. I referred to it as Chapter 40A, and it's within the constraints of Chapter 40A that all cities and towns adopt their zoning bylaws. What happens in California, it happens out there. I don't really care what happens out there because we can only do what we are allowed to do in Massachusetts. And we have constraints on the utilization of zoning bylaws to zone out, as I referred to, sober houses. I'm not familiar, Mr. Heelan, with the statute in California. I'm not familiar with the Superior Court case in California. I would probably like to see them. They might be instructive. But as being controlling on what we can do here, they are not.
thank you. And I think Mr. Viera wants to, he wants to weigh in specifically to that question.
Sure. Mike, were you here during Frank's initial presentation?
No, I was late from work.
Okay,
I'm
so
sorry,
what
Dave.
Frank talked about was when Falmouth did exactly that.
Okay.
And the 2 homes on Lakeshore Drive brought suit against the town. And over the course of a period of negotiations, there was a settlement in 2001 where the settlement was to allow no more than 2 individuals to live per bedroom, subject to the inspections for health and safety.
Okay.
So the exact bylaw, zoning law you're talking about, was the exact law that this town tried to enforce in 2001, which brought the suit against the town, and we negotiated the settlement based on the zoning bylaws in Massachusetts.
Okay. Then I have one more question about the 40A, if I could. You're familiar with Wilmington just passed a zoning bylaw, 40A, that a detox center, et cetera, can only be zoned in certain parts of town. So that is something that Falmouth could do. We could rezone our town to allow detoxes in town, but allow them in certain, zoning districts in town, correct?
Well, I'm not sure of the answer, but a detox center to me indicates that it's licensed by the state. And if there's a license involved, generally we have power to zone it to specific districts. Sober houses are not licensed, so we don't have the power.
Well, that was a rehab question, detox
But,
question.
again, you're dealing with specifics that I'm not really able to answer to your satisfaction right now, but certainly if there's a way to do something and we can find it, we can do it.
Okay, I have one last question. I got an email this morning from Peter Johnson-Staub, Assistant Town Manager, and correct me if I'm wrong, Peter, but he had said that there was an informal inquiry about a potential change several weeks ago from an entity considering a treatment facility at 545 Main Street. And now 545 Main Street, correct me if I'm wrong, is the Royal Nursing Home next to St. Patrick's. So there has been no formal narrative, but people have been asking about this. I know this came out last week through some, online chatter, but I just wanted to make sure, I wanted to ask the selectmen if you were all aware of this 545 Main Street informal inquiry, and if so, when were you made aware of this?
I'm happy to speak for the board. That hasn't come before us.
Okay.
As far as, I think Mr. Brown has his hand up to make a comment, but that is nothing that's come before our board. We don't meet informally. We meet as a board, sometimes in executive session, and as you know, when we're in executive session, whatever we're meeting about is posted on the agenda. Obviously, the content of that meeting is sometimes not disclosed till later, but any content that we meet about is always on an agenda. We have not met, we don't have anything that's before us about that issue. If Mr. Brown wants to speak further.
We just got an email
ahead,
from
Diana, can
Mr.
you-
Suso, 2-3 months ago, that there was an inquiry about the possible use of that nursing home. There was no
Okay.
further follow-up, and we don't have any more information to share.
An informal inquiry and nothing, no like hard and fast narratives of them doing anything, right? That's
To
what I
my
got.
knowledge, they were
Okay.
just asking about the possibilities, and I didn't really hear anything else about it.
And that's what, in the process of how one would go about, that's kind of what I got from your email. So awesome, thank you so much.
Okay, thank you. Ms. Moda,
Hi.
I think you just need to be pretty close to the microphone so folks can hear you.
All right. First of all, I want to know why any of you on this panel, you, would make a decision on our behalf without looking into it. You know, do you know that the ADA does not consider active addiction to be a disability, neither does the FHAA. Google it. I mean, it's ridiculous. You sit up here and you're trying to make excuses for people's lives. There's a Sober Living Foundation. This Sober Living Foundation has their hands in everything. All right? It's considered an LLC, so is Recovery Without Walls and a few other ones, which basically says it's limited liability. They're getting paid. There's liability there, all right? As for calling MASH, I called MASH. You know how many times I called MASH? 11. And I got told the same thing. It's not our responsibility. They're not certified. Everybody, Department of State, State Department of Public Health, BSAS, everybody, DiMacedo's office, I called everybody. Nobody wanted to hear anything I had to say, all right? You guys want to know how many people are from out of town? Would you like to see the papers with all the license plates that I've written down of people coming in and out of my neighborhood, selling drugs, all right? We have people prostituting at the top of my road, okay? Don't sit here and try to act like you know what it feels like, all right? That's discrimination against us. I'm sorry. You take one section of town and you say, here, you guys deal with it. As far as certified, that they have to do something, rigorous test, come on, please. All right? None of these houses are certified. None of them have anybody to deal with these problems on the inside of the house. So then maybe you could alleviate our EMTs and our police officers. They are so overwhelmed, okay? Overwhelmed. And it's because of the Sober Living Foundation, okay, that wants to keep robbing the state, wants to exploit vulnerable people, put them in deplorable conditions, okay?
Ms. Moda, do you have a question? I just want to,
The question is I want to know is, how did you come to making the decision for us? We selected you, right? So, did you look into the laws? When you're claiming discrimination and you're saying that that's the reason we have to deal with all this and suffer and watch all this devastation, did you guys look into that? Did any
Okay.
of you look to see what the information was?
So the question from
Definition.
Ms. Moda is,
I asked the question. Did you guys look into that?
did anybody look into the law, is the question.
When they placed all these homes in our area.
So my question is, what decision did either the state
By-
legislature or the Board of Selectmen make?
By just putting these sober homes in our neighborhoods. Where
Who,
we
who on this
notified-
stage placed a sober home in your neighborhood?
Who on
Who?
the stage?
Who here placed a sober home in any
No,
neighborhood
I
in
said the
Falmouth?
Sober Living Foundation, and they had a say in whether or not they came. If they looked up the definition of what the ADA is, if they're gonna say that it's discrimination if we don't do this,
Why wouldn't you guys look up the definition of discrimination, and then you would see what the laws are?
I'm not sure who the foundation is. Is there anybody from this foundation group that she's saying made a decision?
Right there, Troy Clarkson.
The Sober Living Foundation?
Yeah.
Okay, so that's not elected officials sitting up here that made a decision.
I'll beg to
I
differ.
think this is what, I
Okay.
think this is what is
Okay.
so important, that we tried in Falmouth
Mhm.
to regulate sober homes a number of years ago, and went through an intensive review, not on Google, but on Westlaw, and looked at court cases and worked with the attorneys to see to what extent could Falmouth, through its zoning bylaw, regulate
Okay.
sober houses, of which we ended up with a lawsuit, and we settled it because we were going to lose it in 2001. The sober houses that are opening, whether certified or not certified, are being opened by individuals or organizations that own property. No vote of a board, no vote of the legislature is taken for a sober house to open. The issue that we have, and in 2014, when the state commissioned the Special Commission Task Force to review sober homes and came up with this law that has the incentive that doesn't allow referrals without certification, created MASH as the entity subcontracted by the Commonwealth, was to find ways within the law that we could try to bring some stability to neighborhoods and to those in recovery living in sober houses.
Mhm.
We went from 3 certified sober houses in Falmouth to 17 tonight, and 2 months ago when I checked it was 15, so we ended up with 2 more in the last couple of months. Without changing an act of Congress, which also deals with decisions made by the United States Supreme Court, Falmouth and each community that hosts sober houses, we really need to find ways to pressure and to incentivize those landlords, those individuals or organizations that are just looking to make $1 off 2 beds in every bedroom, and say, that is not what you should be doing in Falmouth. That is not what you should be doing in the United States. That is not what you should be doing with individuals whose lives are in recovery and are on the edge. How do we do that? I'm hoping that together all of us can discuss how we can do that and not point fingers at individuals who aren't sitting at the stage. Out there, and I'm going to point up high, out there are property owners in this community who are doing the wrong thing, and we need to hold them accountable. And so when you find the drugs and you have the numbers, the plate numbers, give it to the chief. Let's get the directed patrols to arrest the drug dealers in those neighborhoods. If you find out there's 3 people living in a bedroom, you call Chief Small, and let's go do an inspection and shut it down, because there should be no more than 2 per bedroom. We've got to focus on what we can do and how do we move forward. Too many of these forums that I come to, we just want to be angry with everybody here, and those bad folks are still out there running bad operations.
Diana, I'm just gonna,
What I meant by
we're-
Google was discrimination. If you looked it up, you would see it.
we
okay?
will Google it, but we're just
Please
gonna
do.
move
Please
forward.
do,
We will.
okay?
We're gonna move forward because I have
Yeah.
folks here and over here who are
I'm
also
saying
waiting.
Everything that they want to say. I
Okay,
mean,
thank you.
eventually.
Thank you, Ms. Moda. Sue, did you want to make a comment?
Just a quick follow-up to Rep. Vieira's comment, and that's the other side of the coin, because there are represented in town, in this audience, many excellent caregivers, many excellent treatment representatives, Falmouth Hospital, various private organizations that are really responding to a health crisis. Folks in your family, your neighbors, it is it's a treatment that's needed, and the community has to certainly look at if there's someone that is not complying with the law. If there's someone who, there is a complaint, there certainly are complaint services. You can talk about that. But at the very same time, we have a health crisis that costs the economy a lot of money. It costs your coworkers who have substance abuse issues. All of those folks need to get support from somewhere. And in Falmouth, we also have some excellent services. So you have to look at it at forums like this with experts, a 360 view, and see what we're doing right and what we could do better. It's the whole picture.
Thank you. Sir?
Thank you. Steve Kramer, I'm from Mashpee. The question that I have is that when the legislation was passed, I don't believe, from what I've read of it, there is a finite time period that any one sober house can stay in effect. And I think that's one perhaps oversight that existed when they looked at it, because obviously there's a concern on behalf of anyone who's living adjacent to it, not because of perhaps whether it be the effects of somebody who shouldn't be there, but the more important thing is if someone owns a home and they sell it, they do have to disclose the fact that a sober home was there. I do real estate litigation, and I'm fairly sure that that would be a disclosure of a fact that would be material. So I'm just wondering, was there ever a thought of having at least a finite period that one location can have, like a 5-year limit before it moved to another place, so it wouldn't have a permanent effect on the value of those that are abutters, and perhaps at least it would move into some other location without somebody being able to keep it there permanently?
Thank you. Frank, did you just want to sort of speak to that?
I'm not aware of any attempt to limit the duration of sober houses. It may have come up in discussion someplace, but it never made it into the final version of the law that I'm aware of. Just one other point that I'd like to follow up. Ms. Moda made a comment that, and she's right, that people who are actively using alcohol or drugs are not part of the protected class, and they don't have the benefit of the Federal Fair Housing Act and the reasonable accommodations or the exemptions. Those people are violating the law and they may be prosecuted. The protections of the law goes to people in recovery.
I just add, the last thing is that for those who are with the legislature, it might be something to consider to have a 5-year limit on one location, and then it would go to somewhere else, so that at least for homeowners, it wouldn't have a permanent effect on them, and it would be going to another neighborhood. Might be something to consider.
Thank you, Mr. Kramer. Senator DiMacedo, did you want to speak to that?
Just that, in regards to his point, they mentioned that these sober homes are considered like a residential property. So if that's the case, and we're saying just these sober homes can only last for 5 years, then one would surmise, then they could say, well, you can only live in this house for 5 years. That's the limitation that you have. You can't differentiate a sober home from a residential property. So that's why I don't believe that was ever a consideration, because in fact these sober homes are considered residential properties under the law, and court cases, many court cases subsequent to that have verified that fact.
Thank you, Senator. Sir?
Yes, Larry Marsh from Mashpee, and I want to thank you all for making this possible. I think this is an area that a lot of people are concerned about, and there's not a lot of answers. I have a question that goes right to the root of why there doesn't seem to be any oversight. And my question is, there are many types of other group homes that are protected under the federal law. I think there's group homes and there's shelters, there's halfway houses and all types of facilities. I am not aware of any other group that doesn't require some type of oversight at any level in the whole state. No licenses, no, is there? Is this the first? That's a question.
Frank, can you?
I can add into that.
Okay, Derek.
All right, you get that? All right, I'm back. Okay. So the group homes, when it comes to the substance use treatment level of care continuum. Group home would be comparable to our recovery homes. Recovery homes, therapeutic communities, social models. So those are viewed as treatment facilities where oversight would come from the Bureau of Substance Addiction Services, Department of Public Health. Licensed inspectors would, do biannual visits. Contract managers would go out and monitor those programs. The sober houses are viewed as just that, housing. They are not viewed as treatment facilities. I would, there's definitely, we have many recovery homes throughout the state. Many times there are, providers who are interested in, opening up, another home and going through the licensing process. And it's much more, I would say, involved with staffing and, eventually funding, either through, through the Department of Public Health or, or through other entities, Mass Health and private insurers. But that's the view on that one is viewed as a treatment facility, the group homes are, and the sober housing is not.
Thank you. Larissa?
I think the other thing too, just to understand a little bit, I definitely understand some of your concerns and people's concerns, but, prior to 2 years ago, there was nothing, for sober homes. Sober homes operated the way they wanted to run, and it doesn't mean that some of them weren't operating a perfect sober home. I'm sure some of them were, but, with the advent of the Mass Sober Homes Law, there is this voluntary certification process which really has brought a lot of these operators up, to a higher standard. And there is a process to manage issues in these houses that are certified if they're not up to that standard. And that's a big deal that the Commonwealth adopted that. There was nothing prior to 2016, so I guess I just want to talk about the positive part of what the Commonwealth is doing.
I just make a comment.
Thank
I just
you.
have one other question.
Sure, go ahead.
Look, I understand it's a step forward, and I'm not saying it's not, but there's no line of authority or responsibility that I can see for complaints, not from within, but from outside. And I just don't understand why we're not moving in that direction. I'm not saying they shouldn't be protected. I'm not saying, I think that's probably a good program. But I do think there needs to be something out there at the state and local level where we can if we have a problem, we know where we can go, whether they're certified or not. The other question I have is really very specific and it's quick. If you're in an association that has its own set of rules, like Seacoast Shores or any of them, about what's required of all residents, are these homes subject to the same rules? For example, parking overnight on the street, or how many cars per home, or can they park in the grass? There's probably a dozen different things, but that's just one of them. Are they subject to these rules?
Thank you. Frank, can you speak to that piece? And I'm just going to speak to the former comment that he made. If I may.
Well, sir, many communities and neighborhoods have what are known as restrictive covenants. Generally, they provide that, dwellings will be occupied by one family. They may have a limit on the number of cars involved that can be parked, and a number of other restraints on the use of the property. Those are private restrictions, and the town does not enforce them. It's up to the residents to communally enforce them as a group.
And are we allowed to?
Oh, yes, you are, sir. Absolutely.
Thank you.
Thank you. And if I can just speak to the other comment that you made, sir, just in that there's a reason why the folks are on this stage tonight. If individuals are seeing things at homes that they are concerned about, if there are issues that touch upon sanitary issues, we have, a way to address those issues with our town. If there are safety concerns, if there are concerns about criminal activity, we have the two chiefs here and their departments that address that. If there are issues, around any of those items or activities that might come around a sober home that you believe isn't being run well, you can address that here in your town. And as we've heard, if you can certainly call and notify and file a grievance with MASH. If it's a certified sober home, they will take action. If it's not, they keep some limited data on that. But all of the actual sort of extrinsic things that happen outside of a home that might concern you as a neighbor or someone in your community, Those are things that you bring to the appropriate departments in your town. Again, if you're seeing criminal activity, et cetera. So there isn't no ability to sort of weigh in on those things. So, okay, go ahead.
My name is Esther Ann Price, and a couple of things. I think MASH is great, and I'm glad at least something is being done for the sober homes. What I don't understand, and I just can't grasp, is I sent to all the selectmen a TED Talk. And the topic of the TED Talk was in the New York Times several years ago. And to me, it makes a lot of common sense. And I see it happening with the kids growing up, and you could have read some of the comments that came up after I posted the TED Talk. They were very interesting. One of the things, and I don't know how you do this or how you can, I mean, a lot of times we look at Gosnold, and Gosnold looks like a spin dry and ship them out. 7 days, get them sober, detox them, and then send them someplace, whether it be a sober home or not, or people will find sober homes. We're not treating, and I'm not, this is not information that I've made up. This is from many long discussions with my nephew, who has been struggling. He's 28, he has been struggling since he was 15 years old. And he had a relapse a month ago, and I applauded him for calling me very quickly to let me know. And then explaining to me financially he could not stay the entire 30 days. He needed to get back home, get to work. But he got something there he had gotten no place else. And that was therapy. And I said to him, what started this with you, Jonathan? He said, Auntie, it's in your head. It's depression. It's anxiety. It's not fitting in. And, you know, that's a part that nobody's requiring. There be somebody who can deal with that, even at a MASH sober home. And that's a critical part. If an addict is telling me that, I think there's something that's missing. And if they're not getting that treatment, I mean, a fever is a symptom of the flu. Addiction is a symptom of something underlying. Something starts it. It doesn't just happen. You don't wake up one day and say, I'm going to shoot heroin. Something has happened. Something has made you vulnerable to it. Because there are a lot of us out there. I have been taking opiates since I was a teenager. And I am not an addict. I live in a lot of pain. And I use them as I should. Okay.
Okay, so if
Sorry.
folks can just speak into the microphone. There are also lots of seats here if people really can't hear, but if we can just get really close to the microphone,
Okay.
will help. But please come down, that entire side over there is empty. Go ahead, Esther, sorry, go ahead.
And I think that's something that should be considered and should be part of it, is providing these people with the real help they need. Just detoxing them and sending them in, telling them to get a job, and watching them is not going to do it. If you don't help and find out why, it's not going to change.
Thank you, Esther. Thank you. Thank you. Go ahead.
My name is Kurt McCall. I live in Falmouth. I have a question about financing, and I came in a couple minutes late, and maybe I missed this. Who pays the rent to the landlords of these houses?
The tenants do,
The tenants themselves do.
yes.
Okay. And by extension, this concept of voluntary certification sort of stymies me, because I lived in New York before the certification of nursing homes, and there were so many abuses before the requirements for certification. It's not, and I'm a retired physician, and I just can't wrap my hands around the concept of having housing for people that really need to be taken care of where there's no required certification. I think this is an awful idea, and I think the push ought to be under, however we do it, to get these homes under certification with a study of outcomes and with a study of police response and with a study of cost effectiveness. I mean, I don't know what the body of literature is. How cost effective is this versus other types of therapy? I know it's not therapy, but it is. It's a way of getting people through a crisis. And it's a laudable way, but do we have any idea of what this is costing us, aside from quality of life issues that a number of people expected, and is there a better way? But more importantly, how can we sit here and talk about voluntary certification and not knowing how many of these houses exist in our neighborhoods? It's beyond my comprehension as a retired doc. Thank you.
Thank you. I know we've touched quite a bit on that particular piece. Does anybody else want to speak once again to sort of the legal piece of the certification? I don't want to belabor the point, but I know the gentleman said he came in a little bit late.
I mean, again, I'm not an attorney, but it is voluntary because it's not treatment. It's a home that people are living in. It's part of a continuum of care for people in recovery. And the idea is that by the time they get to a sober home, they're sober. That's why there's no treatment at a sober home. Right. And so that's, that's the idea. Does it mean that there aren't issues sometimes in a house where someone can't stay sober? Of course, it's a disease. That's what we're dealing with here. But that's why they're not licensed, right? It's not treatment. That's the distinction.
Thank you. David?
The main reason why we impaneled the 2014 Task Force Special Commission was to find out where we could regulate. And so for the course of a year and a half, the legal minds, minus Google, went and reviewed the Supreme Court decisions, looked at the laws that were attempted to be passed in states, those that went under federal challenge, some that were open, some are still open, some that were resolved against the state regulation. And that is where this voluntary registration program came, because it is illegal under federal law in the United States of America right now to put licensure and regulations under these types of housing. So I think what we all need to do is start writing letters to Congressman Keating, to Senator Markey, who we invited to be here tonight, and we heard back yesterday that they weren't able to send somebody, and Senator Warren. Change the federal law so that we can bring reasonable regulations and that can be upheld in the federal courts. We can't do that at the municipal or state level. The closest thing we could do was to say, you get no referrals from any treatment programs that receive any money from the Commonwealth unless you certify. Until then, let's all start getting our federal delegation to change the federal law.
Thank you. Sir?
Hi, Chris Bernard. You kind of answered my question. I was wondering when...
Sorry, I don't mean to keep... I know, you just gotta...
That's right.
It's okay.
I was wondering when the last time the law was revisited. 2001 is a long time, obviously 17 years, but you kind of just alluded to that by saying 2014, a task force reviewed it.
Yes.
I guess I was just wondering, is there an annual process in place to review new laws? I don't know about California or what's going on, but just curious, if maybe as a town to kind of consider looking at that, because obviously laws change, bylaws change in response to those laws. Just, I guess, something I was wondering about.
Thank you. I don't know if one of the reps or Senator DiMacedo wants to talk about Liz Miranda. I know she has some legislation for another commission, maybe. I don't know where that stands, so if anyone wants to speak to that.
I'll touch on this briefly. So, can you guys hear me? Yeah, in the back? Okay. So, just as I mentioned this earlier as well, but I think it's another point to underscore, especially when you talk about economic incentives to certification, the fact that we only exempted certified sober homes as part of the room rental tax just a year ago. That's a really large economic incentive for these places to get certified so that they are delivering the best care for those in need. And then there's a couple bill is in front of the State House. I'm a co-sponsor of Diana DeZoglio's bill, which sets up a commission to kind of revisit this and look at different kind of best practices for sober homes. And there's a whole host of things it outlines. I'd be happy to send you a copy of the bill, but it does that. It revisits it, sets up an additional commission to look at best practices, come up with best practices, and then actually gives the state authority to promulgate regulations based on their findings. It's something that I'm supportive of. I think my colleagues up here are as well, but happy to give you the full details of the bill.
Obviously, what MASH is doing is great, but we all know without some type of authority, sometimes it's hard to obviously enforce anything. Thank you.
Absolutely. Thank you. Great question.
Can I just comment on that
Of
quickly?
course, yes,
So
Larissa.
we do have best practices that exist, and they're national best practices. And the Commonwealth actually developed their own standards and best practices based off of those national standards. They are all listed on the MASH website, so if you want to look at them for some light reading, feel free. But if you're curious about what it takes to become a certified sober home, to be a certified sober home in the Commonwealth, you'll find everything listed there.
Thank you. Go ahead, ma'am.
Hi, sorry. My name is Jennifer Cullum, and I'm actually a town councilor from Barnstable. And thank you very much for putting this together.
Thanks for
because
coming.
we have similar pathways, parallel pathways here. And I really appreciate the time and effort of everyone at the board right now. I do want to say that Hyannis is my precinct, Precinct 13. We are inundated in sober homes. Many of them hide behind the Dover Amendment, which is within the state's power to change and review. So I have had many meetings. Our legal department drew up a proposal. I went and stood on Beacon Hill and spoke about HB 3881. You may want to check into it. It was shot down. And it was really about excluding sober homes from R1 residential neighborhoods, giving us the power to zone them out. And it all fell back on it being the political third rail because of the Dover Amendment and the educational exemption. So I would encourage you as our elected delegation to maybe join forces with Senator Sear and Will Crocker and Tim Whalen, who have all worked with me on that. Again, my name is Jennifer Cullum, and I just also wanted to say that it's a really difficult problem because there are only pockets around the state that suffer from this. So Hyannis is one, Falmouth is one, Fall River is one, Lowell, Chelsea, right? But not every little community is feeling the burden and the weight of homelessness and sober homes. And guess what? They don't want to bear the weight. They're happy that we're bearing the weight. But I've always said that just like we look at wastewater regionally, we should look at homelessness and addiction in a regional way. And we need our whole delegation, everyone on board, from Sarah Peak all the way up. And I agree with you about the feds. We got to get them moving on it. But it's within your power, really, to review the Dover Amendment. And I was shocked that I had no support on it. And I will say Rep. Crocker really helped me and get a seat at the table to discuss it. So if we're serious about helping our local communities, I realize you can only do what you can do because that's all I can do as an elected official, but it's well within your wheelhouse to review that educational component because it's burying us. So can I get a commitment? That's my question.
Mm-hmm.
So, the home rule petition request from the town of Barnstable was not addressing specific sober homes. It was addressing a specific organization, which Falmouth has 2 of those such homes for homeless individuals, one for males and one for females in the town of Falmouth. They're well managed. Most people in Falmouth don't even know that they exist in Falmouth. And so that's why I didn't support that amendment, because you were targeting not sober homes, and you know exactly what I'm talking about.
Well, that's pretty argumentative. I think that if you lived in my
Argumentative, it's the truth.
If you lived in my precinct and you had 5 said sober homes because you have town sewer, pardon? I don't think everyone can hear you.
I said that's not what you were trying to regulate.
My question to you is, will you at the state level support a review of the Dover Amendment and the educational component thereof?
Yes.
Excellent.
And there's no education component in sober homes, folks, so it doesn't address the issue we're talking about tonight.
But it does address the greater issue of degradation of
It does
neighborhoods.
address the issue with a particular homeless program in the town of Hyannis, in the village of Hyannis.
It also addressed Harvard University, though, when it was passed, right? Thank you very much for your time. I appreciate it.
Thank you. There you go.
Hi. Okay, so I'm really short, sorry. So I just have a couple questions that I've kind of collected. They may have already been answered. My biggest thing is, how do people are getting into these non-MASH certified homes from treatment centers if they can only be referred to certified?
So let's start with that one. I just want to break it down each one. So can someone just clarify how someone comes from treatment and doesn't go to a MASH certified home?
We don't, it's against the law for a treatment facility to refer one of their clients to a non-certified sober home. That's all I can say about that. If the treatment facility is not following the procedure in the law, then that's an issue for them.
So just quickly, who would they address, like who would we address if that is the case? If you know for a fact that these treatment facilities are sending to non-certified homes?
I mean, you could certainly contact someone at the Commonwealth and let them know, the Bureau of FACILITES is the one who licenses the facilities. Derek can probably speak to that. I understand your concern. We can't do anything about that because those treatment centers aren't under our purview, that's all.
So maybe Derek, could you just speak to that piece there? How someone, if they had that concern or complaint, would pass that along?
So by law, yes, the referring programs can only refer to certified sober houses. As we know in the programs that we license and fund, an individual can leave that program and discharge. These are voluntary programs that we're talking about here, not involuntary services. But in good faith and by the law and through the licensing and the funding, these programs should be referring to only certified programs and working with those programs. If someone has a concern or a complaint about that, at BSAS we contact myself. I'll give you my contact information after this. I'd probably say go that direction rather than contact the compliance officers at BSAS, because there might be something on a smaller scale that we can look into, provide the appropriate technical assistance, and make sure that programs are doing it correctly.
Okay, next question.
Okay, so is there a way that we can regulate non-certified homes, like a list of, not so much, we don't care who's living in the home, we just wanted head count and addresses of locations. So, just so that way we can have a better idea as to exactly how many are in the house. Like, do we have to get, if you're gonna register your home as a sober home and allow that to be sober living, it should be registered with the town. It should, just like we have to do a doing business as, even if we're not gonna be doing, filing our taxes or anything like that, we still have to regulate with the town so they know who's gonna be, having business being done in town. Why is that separate from, a sober home? They're gaining an income, and it should be accounted for.
Frank, do you just want to speak to that maybe again? The town's ability to force non-certified sober homes to register.
Again, I look at that in terms of our authority. The town can only do what it is authorized to do by state law, and I'm not aware that we have the authority to do it. It seems to me to be a legislative issue.
Okay, well, to play off of that, I actually did the math. I have a couple of friends that are in recovery, one of which was actually just recently kicked out because they have an 18-month allowance to stay in one sober home. I did work for a treatment center for a short time, and I noticed that the turnover was very quickly. It was basically a big whirlwind. A lot of people there just didn't care. They didn't care to help the patients. They were, rather take vacations and so on and so forth. So I saw a lot of the other side of this. Just this one home in West Falmouth runs $195 a week for the addict. There were 17 people in this house. That's $3,315 a month, just for starters. But my other question is, can we make sober homes a treatment facility, regulations, like hold it accountable, like we would a treatment facility? If they're going to run a sober home, they should have a manager, they should have a mental health person. I don't see why that's not going to be something that we can put into place. If they want to register their home as a sober home, it's fine, do that, but they need to have mental health, they need to have, counseling. I can also tell you that other, Cosnald, High Point, not a lot of them have secondary follow-ups. Once they go to a sober home, that's it, they're done. They wash their hands. So yeah, that's where I'm at.
All right, thank you. Just so, I know we've touched on it a bit, and we're getting a little bit close, so I'll just, unless someone wants to correct me, I'll just sort of reiterate what we've heard, which is that the current state of federal law and our state law doesn't allow us, if something is designated as a sober home and they're not offering treatment, we can neither force them to offer treatment, nor can we put sort of that list of some of those. I mean, you're raising issues that I think a lot of people feel sort of intuitively would be wonderful if every sober home sort of had that component, but they're really lodging and it's residence rather than treatment, and there's a distinction under the law at the level that we as a municipality cannot, and possibly even at a state level, cannot impact.
So with that, is there a way that we put them into a different category? If they're going to run their home as a sober home, then they should be registered and by law into a different category. It should be a mental health facility location.
Yeah, they're not under the law. I
Right,
hear
but
I hear your concern. We cannot, that is
I
the
understand, but where do we go from there to get that to happen? Is what I'm
federal
saying.
law.
Okay.
Federal law, yeah.
Okay.
And our state law, but mostly federal law. So, go ahead, ma'am. You've been waiting very patiently.
Thank
Go
you.
ahead.
Good evening. My name is Kristen St. Ange, and I am in support of the continuum of care from harm reduction all the way to abstinence. My concern is that as a community, we don't have our thumb on the pulse of the issue regarding the need for housing, whether that be sober housing or single-room occupancies for individuals in our community. I'm a parent of 2 children, a 31-year-old and an 18-year-old. I'm a member of the Cape Verdean community, a licensed independent clinician, as well as a faculty member of behavioral and social sciences at Cape Cod Community College. So when I hear members of this community state that there hasn't been zip code mapping done to understand, which is a best practice in understanding both emergency response supports, when I hear that the practices of individuals that are residing in sober living that are not MASH certified are mandated to turn over their SNAP, or what was called food stamp cards, to house managers, when they are required to pay for urinalysis testing, when they are asked to leave the premises as a result of not following through with protocol of meetings and or morning meetings or being a part of this independent living situation, I'm really concerned for those participants in our community that may be asked to leave as a result of not being able to adhere. So I ask of you, what are we doing as a community to really respond to the issues? Because we are reactively holding these meetings when we engage in town forum. That many of the registered voters in our community don't understand what the need is. When I hear you say that federal guidelines bind us, I understand the FHAA, but the Bureau of Substance Abuse Services, prior to establishing MASH, did a feasibility study in 2010 and stated that local government should be encouraged and supported in the use of existing non-discriminatory legal tools to address legitimate health and safety, building, fire, and zoning, and criminal impacts of sober housing. And that these residents of sober housing should be educated about their consumer protection and fair housing remedies to assert their rights against non-discriminative operations of housing. I don't think it's fair that we're flipping the coin when we are saying that some policies are appropriate and some policies are not appropriate. So whether it's advocating for federal or state changes or local changes, when we're filling an entire filling an auditorium full of community members that are concerned and wanting to see that there are services from harm reduction and needle exchange and also in support of abstinence-based program models. And I'm surprised that we don't have at the table our leading treatment facilities What's changed if we don't have additional beds that have been established in our community, that we have such an increase for sober living?
Okay, thank you. So is there anyone who wants to, David, and then I don't know, we do have folks here, we've invited them as guests. There are folks here from Gosnell, from some other organizations. We're not putting them here up on the stage because this is really looking at sort of a finer point, but I understand your question, and if Rep. Vieira wants to answer it, and if there's anybody else who'd like to speak to that last question.
Yeah, I'd actually just, I want to address, you had mentioned needle exchange, and my understanding was that was going to be a portion of the discussion this evening when we were asked to bring two folks from DPH here, one that oversaw needle exchange and one that oversaw sober houses. But with us tonight is the Chief Operating Officer of the AIDS Support Group of Cape Cod. And as you know, we sat in this auditorium many months ago and discussed the future of a needle exchange in Falmouth. And I took it upon myself to work directly with the AIDS Support Group to try to find a resolution to the site that was initially identified in East Falmouth. And Dan, if you could come up to the microphone, we would like to make an announcement tonight as to the path forward that we've been working on for the last several months on the needle exchange in Falmouth.
Hi, Rep. Vieira. Thank you for the introduction. I just have to say I used to work with Kristen St. Ange, so it's very funny that I'm standing next to her at this moment. Hi, everyone. We just wanted to announce we've been working with Rep. Vieira and a lot of the people on the panel. We've appreciated all the support. We have found a location for our services at T-Ticket Square that we're in the process of working on a lease for, but we wanted to tell the community that based on the feedback from the other community meetings, a lot of people asked if we would consider taking our syringe services outside of the brick and mortar location and go to a mobile outreach. And so we are going to do that. So we will have a location that will have all of our harm reduction services for people living with HIV, Narcan distribution, education on overdose prevention, connection for people who are dealing with addiction to treatment facilities, to behavioral health therapists, to medication-assisted treatment. But our syringe services will be out of a mobile outreach van that we are in the process of having built out. It'll take about 6 months to have it built. It will have, as I've said at a few of the other community meetings, I just want everyone to know this is not a food truck version of a syringe program. It will be a medical clinic on wheels. It will have 2 offices. We will do phlebotomy services there. We will be testing people for HIV, HCV, other sexually transmitted diseases. We will be doing risk assessments and counseling for every person who receives syringes every time they receive syringes. So we thank you for all of the feedback and the support.
Thank you. I'm just looking at the time, and everyone who is in line right now, we're going to take your comment, even if it goes a little bit past, okay? But we are about 13 minutes out. So, Mrs. Halen?
Hi, how are you? First of all, a couple of things. Everybody I listen to, it's a lot of great information, gives me more things to ask questions about. So I'll try not to go on and on. Dan, are you doing the house? Where is Dan? Are you going to do home visits? Yes. You are, but you won't be giving out syringes at the office? Correct. Okay. In your van or you will do like a home visit if people want that?
Yes, we will, and people can also call us to pick up syringes anywhere in the community.
Okay, thank you.
Thank you, Dan.
Dylan, you mentioned making the MASH sober houses tax exempt, which is great. However, the problem is that we don't know who the other houses are. So why would they pay taxes if they're flying under the radar? I don't see that happening.
So they'd be treated just as any other short-term rental passed under the law. So basically, if someone is staying there for less than 31 days, they would be subject to the short-term rental tax.
I do understand that, but...
So it's the same as any other short-term rental that isn't being taxed at the moment.
I do understand what you're saying. What I'm saying is if I decide to open a sober home, I would have to let you know that I'm renting rooms before you would actually tax me, correct?
So if you're opening a sober home...
Non-certified.
Non-certified, right.
I am not going to have to pay taxes unless I call someone and say, hey, guess what? I'm renting out rooms.
So, well, we gave a lot of leeway, in our bill, we gave a lot of leeway to the local municipalities on how they want to regulate sober homes, but essentially, sorry, how they want to regulate short-term rentals, but essentially, short-term rentals, any short-term rental will be in a state database, and they have to be in that state database if they are acting as a short-term rental. And the owner of the short-term rental, if the sober home is renting to people for less than 31 days, according to the Department of Revenue, they qualify as a short-term rental. They would then be operating illegally if they didn't comply with all of the local and state regulations around our short-term rental law.
And let me just address that piece. I know that the town, because this short-term rental tax is fairly new, we are looking as a town at how we can kind of wrap our arms around the Airbnbs, all that fall into this category. How do we wrap our arms around identifying, because this is a brand new tax? So that is, we'll have more information as that's happening, but it's something that the town is looking into about how to kind of pull those properties in.
Okay, yeah, because I'm thinking it's not going to be an easy thing to identify them. I wanted to say, this summer I went and I met with Mr. Palmer from the building department. He told me that if there were any complaints about sober homes or any home with occupancy, et cetera, if he went there, all they had to say was, this is a sober home, and he would turn around and walk away because they are protected by the ADA. Now, one of your speakers just said that if there is active drug or alcohol use, and I believe that town council just reiterated that, they are no longer protected under that thing. And I asked Mr. Palmer about that, and he said, well, how would we know? Well, when you're getting calls to a home because there's an overdose, it's pretty clear that it's not a sober home at that point. So to put, let's say, a treatment facility or a sober home and say they are protected because of the ADA, if they're not complying with sobriety, I don't think they're still protected. I spoke with the Mass Office of Disabilities today. She told me that this story about Americans with disabilities is just not accurate, that each facility and each home should be judged on a case-by-case basis. She said it's a zoning issue, it is not a disability issue. If I wanted to say I'm going to build a home and I'm going to put any type of disability people in there, I still have to follow the rules of the town. And to say, well, I'm going to put my house closer to the street than I'm supposed to, or I'm going to add a bigger house than I'm supposed to put on a lot, and I can do it because I'm protected by the ADA, she said that's patently false.
Right. I don't think anyone here tonight has said that having a sober house exempts you from every sort of building and zoning restriction. We're talking about and again, Falmouth has a particular lawsuit that we are under a court, an order essentially, a judgment that came out of a case around some of these issues. So I don't want anybody to get the idea that there's some sort of magic carte blanche if you have a sober home. You still have to comply
rules.
with laws, but
Right.
there are some things that you don't comply with in the same way.
Okay,
And most
and-
of those things are residency, number of people, that type of piece.
Just two more things.
Okay.
There's been credible, and apparently there was an email sent today from the town manager's office that there is talk of opening a treatment center on Main Street, but it needs to go through special permitting or special use permitting. Who would be in charge of that, and what would that entail?
Mr. Palmer, do you want to speak to that since you're close to the microphone and that's your wheelhouse?
Okay. Sure, my name is Rod Palmer, Falmouth Building Commissioner. So there has been an inquiry relative to that building on Main Street. And each day
Bless you.
within my office, there's inquiries about many different properties. And what I typically ask for if folks are exploring the change of a use or occupying a building is a complete and thorough narrative of that proposed use. The building that might be utilized would require a code summary to determine whether or not that building can accommodate that particular use. And an application for a certificate of occupancy would also be required, none of which we've received yet.
Thank you. Okay.
Mr. Palmer also mentioned to me this summer that if neighbors, abutters, whatever, could show that there would be undue, I don't know what the word is, detriment to their property, that they could express those concerns at a meeting. I'm assuming there would be a meeting if that was to happen. Someone was trying to get a place put in there?
Well, depending on whether or not that particular applicant would need to apply for a special permit, perhaps, if there was a need for a special permit or a variance or
That is what was said in the email.
or site plan approval, if there's the need for an applicant to apply for any type of permit being
Yeah,
zoning.
that is what went out into the email from the
Then there would be a
manager's
public
office.
hearing, and those abutters would have
Okay.
the right to.
Final question.
Okay.
Um,
Thank you, Mr. Palmer.
At town meeting, Mr. Clarkson spoke from the floor and mentioned that it may come to a point, at some point, that Gosnold may want to partner with a larger, I believe he said national company, but a larger company, and I do see there's representatives here. I'd like them to address that, if that's a plan, or can you say it won't ever be a plan, or it may be a plan?
I can't promise it will never be a plan, but I can tell you right now, there is no plan for us to partner with a national company.
Thank you. Okay, I just want to skip over because I do want to get the folks that are in line. Go ahead.
Thank you, Madam Chairman. My name is Troy Clarkson, and among other things, I am indeed the president of a nonprofit charitable organization named the Sober Living Foundation. At the beginning of the forum, Madam Chairman, you mentioned that surrounding this issue, there's been a lot of misinformation and the absence of facts. So, first of all, I'd like to agree with that. But second of all, give a hearty thank you to the people up on this stage who are here precisely for the purpose to have a factual and reasonable discussion about this very important public health issue. Because so much of this discussion in the recent months and years really has been based on the absence of facts and emotion and conjecture. And no one in this room, the people on the stage or the people impacted by sober living in our community, benefit from an absence of facts. So I'd like to I rose particularly to address what was said by a previous speaker about the Sober Living Foundation. It is a nonprofit organization whose directors are all volunteers and serve without compensation. It was created for the very fact that we saw some of us that are on the board who are members of the recovery community, or others who have loved ones who are in the recovery community, saw a lack of services from people leaving treatment and really wanted to be helpful in that space and help people get better services in early recovery. But what that's turned into by some people that have spoken tonight, or people that have discussions on social media that are not based in fact, is that it's somehow a profit-making venture that's lording over sober housing in our community and creating an environment where people are profiting off of sober housing. And so I think it's really important that we continue to have forums like this so we have a fact-based discussion and not respond to just really wild and inaccurate statements that are made on social media by people who don't know the facts and don't understand the situation. So let me just be very clear to respond to some of that misinformation that's been out there. Neither my wife nor I are in any way benefit from sober housing in our community. The Sober Living Foundation does not own or benefit in any way from sober housing in our community. So I'm putting that out there as a fact so that the people who continue to say those things that they know not to be true in discussions in our community can maybe return to a less emotional and fact-based discussion, because the only way we're going to solve this is if we stop demonizing people in our community and start working together. Thank you.
Thank you.
Hi, my name is Lynn Barbie, and I live in Mashpee, but I do live down the road from a couple of sober houses. I also participate in a support group called Parents Supporting Parents. And I just want to say that the people, what's not being talked about here is the real crisis of addiction. And from my experience and from the people that I spend a lot of time with, sober living, having a sober home is a very critical part of a person's recovery, because treatment plans are wonderful, but they're expensive, and you run out of money at a certain point, and recovery is years long. So having a good sober house, I believe, is a really critical part of dealing with the opioid crisis and people's recovery. And the people who are in recovery, they want a good sober home. They don't want people using in their sober home, because that is one of the most terrifying things, because we know now it's very deadly. It's more deadly than it has been in the past because of fentanyl. So I would just like to say, please, if you have a sober home anywhere near your house, understand that there are very vulnerable people who are living there, and they're trying their best to be well. And we need to give them a lot of support for that. And I wish there was more money put into the whole system from the state and from the feds to be able to do a better job with that. But I want to thank you all for having this forum, and just say, if you don't understand addiction, come and see us at the drop-in night that we have at the Community Health Center in Mashpee. There are all these different organizations that are there, and they will give you a lot of information. And I know there are people in this room who are in recovery, and I think we just have to honor their struggle. Thank you.
Thank you.
Good evening. My name is Dave Carmichael, and I am actually in a sober house in Falmouth. I have been through the Gosnell program, and I have to tell you, these people are great. They've saved my life. I am in an absolutely positively great sober house. I'm a licensed electrician of 20 years. I've come down here, and I plan on staying down here. The sober house that I live in has a great manager who does not put up with anything. He's trying his best to work with the neighbors and to work with us. And I myself am trying my hardest to stay clean and do the right thing, and I plan to volunteer and help this community. So please have an open mind. There are those of us that are really trying hard to do the right thing. There are good people there. If it was somebody in your family, you would feel differently. We are good people. We're trying very hard. Thank you, ladies and gentlemen, for your time. I really appreciate it. God bless.
Joe, go ahead.
I'm Joe LeMay. I live in Precinct 9 here in Falmouth.
You just got to go closer to the microphone, Joe, sorry.
And I have been sober 26 years. Now, I saved myself. I didn't have to go through a program. I didn't have to hit rock bottom. I now work in Falmouth for 7 not-for-profits. 2 of them require me to go into sober homes and help out the individuals. I have been in 24 sober homes, all 17 of the certified ones, and several others. I have seen the certification program improve many of the houses. But I'll also state that the best men's house in town and the best women's house in town that I've been in are not certified. They just haven't gone through the process. They would pass if they did. So the incentives that we have our representatives giving to these houses may push those kind of houses over the edge, and I applaud that. As far as the speaker 5 or 6 ahead of me about questioning whether people leave Gosnell and go to non-certified houses, I move these people out of Gosnell, Miller House, Emerson, and Recovering Champions into their sober houses. I moved them into certified sober houses. So my guess is that they never refer people to non-certified, but I don't know that for a fact. When I move them, they have zero cash. They have zero self-respect. They have zero confidence. Some of them have done extensive damage to their brains. And you know, because when you talk to them, you ask them a question, and there's a long pause. And then they respond. So if they were in a job interview, and the interviewee asks them a question, and there's that long pause, that person may not give this recovering person a job. But they do. They come in the house managers, they all have managers, help them to locate somewhere to work, because the managers have to kick them out if they don't pay the rent. And they want the people to stay in and get the help they need. Now, the sober houses themselves carefully do not do any treatment. Everything is outside the house. The other members of the house bring members to treatment, outpatient, to AA meetings, NA meetings. Inside the houses, they have frequent drug testing on schedule and unannounced. And if you fail those drug tests, the manager will kick you out. He doesn't need a bad apple in the basket. You don't need someone bringing drugs into a house where a lot of people are recovering addicts. So this addiction has taken their entire life away. And going through a Gosnold program and then going through a sober living arrangement to support them, they move up. They start climbing the ladder again. And I have also moved people out of sober houses. Maybe it's 6 months later, maybe it's 2 years later. I gather up their stuff in my little pickup truck and I bring them to their apartment and I move in with them. I bring them to the thrift shops to buy furniture because it's an empty apartment. So these houses can do a great deal of good. Now, in my neighborhood, I have 2 sober houses. Okay? When they opened up, I went marching over to them and knocked on the door and volunteered. One house took up my offer, and we're doing a lot there. What I ended up doing was buying that house a new lawnmower. And the men in that house mow the lawns of the neighbors. This is great. That works. They get, you get paid $10 a lawn or something like that. But that kind of active involvement of the actual neighborhood goes a long way to keeping these houses somewhere that is of tremendous support. And thank you for listening.
Thank you very much, Joe. Ma'am?
Hi, my name's Dr. Corey Vilsant. I'm a research fellow at Harvard Medical School. I'm a principal investigator at the Recovery Research Institute and the Center for Addiction Medicine. In academia, one of the questions that we ask is, does it work? Is it effective? And I can tell you that under the supervision of my boss, John Kelly, I led the first systematic lit review of the scientific literature of recovery residencies. We have it in process right now. I presented to the American Psychological Association about a month ago or so. From this, we have about 20 good papers, 4 base studies, 4 or 5 base studies. The answer is, compared to if somebody were to leave treatment and choose what they wanted to do versus referred and willing to go to a sober living environment, it reduces criminal behavior, it reduces substance use, it improves psychological outcomes for some of the studies. Cost effectiveness has been done. Yes, it is there. Mainly gains from reductions in criminal behavior. So when they choose on their own versus going to the recovery, there was improvements. There's even more rigorous studies comparing one sober home to the other because that's how far advanced the science actually is right now. Yes, you can give an evidence-based referral, if you are a doctor, to a sober living home. Part of what we're trying to do here tonight, though, is weed out the ones that aren't fitting the bill. These numbers are based on averages and means in these studies. So some people are at the top and some people are at the bottom. And so that's why you don't always see what we see in the studies. But we know this is the facts. It is working. It is on the continuum of care. It supports long-term recovery. It does not need to have treatment, but it can. So that's the facts of what we know about that.
Thank you, Doctor. Mark?
Hi, Mark Finneran. First off, I'd like to say that Troy pointed out that there's an absence of facts here, which is absolutely true, but there's also an absence of factual answers. And I think that to continue these things is absolutely necessary. One example is Ms. Sylvester asked the question that I was going to ask of Larissa and Derek. How do these 12 to 112, it's an unknown number, of sober homes fill up with these people if they're only recommended to sober homes? We didn't get any kind of an answer, and the one answer we did get was call the Commonwealth. Have you ever tried to call the Commonwealth? It's useless. I think that you could have fleshed that answer out a little bit more. If you guys don't know anything about it, how are we supposed to?
I think, Mark, if I just want to clarify, what actually was said is if you have a specific instance of, I think Ms. Sylvester said she knew for certain that someone had been referred by, I don't know if she named the agency, but a particular treatment facility to a non-certified sober home. I actually think Derek said, talk to me and give me the information. So I don't think he was, no one was saying just call the Commonwealth. I think he gave a very specific recommendation.
She asked a version of my question, and I'll ask it to you then. How are these sober homes getting filled? The unregistered ones. I mean, they're filled. From who? Oh, that's more than we got on these people.
Okay, well,
All right.
let me
So
just 1 second, Mark. Everybody here tonight came, they're not required to, especially the guests from the state, our elected representatives, although they kind of have to do the stuff. But they're here to answer questions. They're doing the best they can. They don't represent every agency that touches upon this. So I just, they're going to answer the questions that they can. We should be a civil town, and we should be welcoming to people who want to donate their time to us. So if we don't, we can ask a follow-up question, but I don't want to really, there's not a need to criticize these two individuals.
I'm not criticizing, I'm saying we're not getting answers. I mean, which is how I started this. And another, and this will go directly to you. The question was regarding the Royal next door. Selectman Brown's been talking about that being taken over, bought out, or whatever for the last 2 months. You kind of dodged the question.
I didn't dodge it.
Well, you
I
didn't
was asked
answer it. Where did that information come from? And how come you have it and we don't?
This is a town where people talk about a lot of things, through social media, through individuals that they come in contact with. The question was, I think for Mr. Halen, whether or not our board had received an informal inquiry. And the answer is no. You heard from Mr. Palmer. He, in his capacity, gets informal inquiries about many different projects, some that have legs and go forward, and others that just die on the vine. There has been no inquiry made to the Board of Selectmen. How Mr. Brown gets his information, how you or I or anybody else, I mean, that's common sense. We have lots of conversations with people, we hear about things, but as far as the question was, if we've received an inquiry as a board, if we've talked about it, that's what Mr. Halen was asking, and that answer is no, that hasn't come before us, and as Mr. Palmer noted, that's not really the way, and you know, because you pay attention to a lot of meetings, you go to a lot of things, that's not really the chain of the way projects come forward. The Board of Selectmen is not the initial party that people come to for these particular permitting issues.
All right.
So I'm not dodging it.
Much
That's
like
the
the
answer.
first question I had for these people. Mr. Brown, where did you initially hear that?
I told you we got an email from Mr. Suso just saying that there was an inquiry. It was just an informal sharing of information, the way it happens all the time. Nothing further has come forward from it, and that was the end of it.
Yeah, but you're addressing an email from a few days ago when you were talking about it a few months ago. So that's not an answer.
I'm not, Mark. There's no new information.
Well, 2 months ago you talked about it
Okay.
on open meeting.
Exactly.
All right.
I just
Let's
want
go
to
on
leave
the
time
next
for
one.
other people. So
Yeah,
is there
okay,
another
so-
specific question about?
All right. You said that the Board of Selectmen follows the open meeting law. The Board of Health does not. I
Okay.
spoke with the state today, and their claim that the reason this thing has been languishing for 4 months is because they're shorthanded. But they did say that I have the opportunity to amend my complaint, and I'm going to amend it from 1 meeting to 4.
Okay.
All right?
Is there a
Yeah, there's
question
the
about
police-
what's going on
these are
tonight, though?
questions, comments, or whatever. It's all about what's going on.
Right, I know, I'm just
And the
noticing
police,
the time.
Yeah, and nothing against the police, but their graph showed a very limited number of overdoses at sober houses. And I know for a fact that some of these overdoses, they removed the people from the sober houses. We don't know the addresses of the people who live in the when they overdose, whether they live in a sober house or not. So that graph was almost useless, and obviously the number is higher. And also, we've been told that from 2001 and in 2014, there have been ways that we could enforce some of the stuff in these sober houses. Like again, Ms. Sylvester quoted $3,600 a month, and it's a week. And it's actually $13,000 a month some of these places are making. So it is a for-profit business. And if there are
Sober
restrictions
houses
and
don't have to be nonprofits.
whatever, they're making money out there at
Okay.
13 grand a month, you can't deny it. And some of these regulations have been in place since 2001 and 2014. I just suggest to everyone in this room and everybody who's watching at home that starting tomorrow and every week, they call the town, the health department, the board of selectmen, the town manager, and continue to call until they get some satisfaction. Because many of these places are putting 4 people in a bedroom, and that is against the law, and it's been against the law for a long time, and nobody has done anything.
Okay.
Thank you.
Thank you, Mark. Okay. These last 3 folks that are in line here, you guys have been waiting. Are you gonna, okay. Go ahead, Mr. Afonso. No, that's fine. You were sitting up front here. You were in line.
Philip Afonso, Precinct 9, Town Meeting Member, former addict. And my issue with this whole thing is the MASH certification. Because there's a great title, we all trust it, right? Well, it's a MASH certified house, so you know it's got to be good. If you look in this last week's Enterprise, right below the Gosnold overdose, the sober house on T-Ticket Path, overdose, narcotics in the house. So we just heard a little while ago, the ADA should not recognize this as being ADA compliant, right? So my question is, what exactly is your job?
All right,
When
Mr.
there's-
Afonso.
No, I'm not, I'm just trying to be direct.
We're not, but there's a difference between being, just
I don't
a
know of
second.
any MASH people, so.
Just a second. There's
Sure.
a difference between being direct
Yes.
and being confrontational. If
No,
you
no,
want to
I'm
ask, let me show you. Could you explain your job? Could
Can you
you
tell
just
me the street
explain your
address of the
job?
one that you're referring to? I just want to make sure that it's certified. What's the street address?
It's in the Enterprise. I don't remember the exact address.
But you know it's a certified one?
I'm assuming, and I will find that
I don't
answer
want you
for
to assume. I want you to tell me, is it one of the
Okay.
17 certified houses? Because if it is,
I'll find out
I
for
will
you.
be working tomorrow with MASH and the Department of Public Health to make sure that their certification is removed from that house.
I'll have that answer for you by 9 o'clock tonight.
Thank you, and I will follow up.
So, MASH is my big concern. We feel like we have this big, warm, fuzzy blanket because it's MASH certified. But in reality, what are the procedures after there's been an overdose in the house? We know our Falmouth Police Department, they do a follow-up the next day. They offer a ride to Gosnold. They offer pamphlets. They offer help. There's something there. I personally feel like MASH is almost taking X amount of dollars to say, hey, you know what? We're going to send people your way. You give us $175 or whatever the fee is. My point in this is don't put so much faith into MASH certification. As we already heard, one of the best sober houses, an electrician who's in the house had experienced was a non-certified house. We know Gosnold. Is there problems there sometimes? Sure. But the success rate coming out of there is far beyond any issues that they have whatsoever. And the one big issue that nobody's touched on tonight our court systems. I have a family member who stole a Jeep. She's been on heroin since I was 15. She got into a fight. Now, I'm not on drugs, I don't drink. If I were to go into court after just stealing a Jeep and physically assaulting somebody, it's probably gonna be a penalty. But all she had to do was go to a sober house, and there were no charges pressed. This is the issue with our sober houses. When we refer to them as that bad house, when somebody goes to court, it shouldn't just be pushed off. Well, we're gonna put him in a halfway house, we're gonna put him in a sober house. Well, what are we doing to the people that are actually trying to get clean? Like the people that have been up at these microphones tonight. You're not helping them, you're setting them back even further.
Thank you. Let me just, this woman has been waiting for a very long time.
I just want to
Okay,
fix what he
sure.
just said, is I am in a certified house.
Okay, so just to clarify,
And that
you're at a
house I'm talking
certified.
about is the darn good house.
Okay. Okay, we're gonna let this woman who's been waiting a long time go ahead and make her comment or ask her a question.
Okay, so God and I have this unspoken agreement that public speaking is like not supposed to fall on me, but apparently tonight he's played a huge joke. I want to thank all of you for being here tonight, for the information that you've shared, and I want to thank all of you for attending. My name is Nicole. First and foremost, I am a grateful recovering addict and alcoholic. I am not a Falmouth native. However, in December of 2017, when I came here to Emerson, Falmouth became my home. I was 36 years when I started this journey on an active suicide mission. I have 3 beautiful children. I'm a single mom. And I had had enough. That's when God could work with me. It took me 4 months to get into Emerson House, and I stayed 4 months at Emerson House because I realized how much work was involved. And like people have shared tonight, there is a tremendous amount of work involved. Some of us do have mental health issues, some do not. Some of us, from as far back as we can remember, have trauma, abuse, that most of us couldn't wrap our brains around. There is a lot of work. As a community, we are some of the strongest, most resilient, courageous people there are. We've just not found many people that see it in us and encourage anything more than what we've let ourselves become. I have found more love and support here in Falmouth than I've known my entire life with my own family. I've worked really hard. I'm about to celebrate 22 months clean and sober, and this was my first try. I am still not united with my children full time. I had to spend the last year of my father's life as he lost his battle to brain cancer away from him. But I made that choice because I knew if I didn't, I was going to go back out there and finish the job. And people in this town and this community loved me up until I could love myself. And it's an everyday battle. At my 1-year celebration this August, I took over as house manager of my sober house, Freedom House. And I just feel, knowing that this is where I want to raise my kids and put down roots, I feel for each of you in the community and your concerns. I think of it from a parent's perspective now as well. I can't speak on behalf of any other sober houses, but I can speak on behalf of mine, so I'd like to first invite any of you that have any questions, feel free to come up to me afterwards. At our sober house, when women come into the home, we find out what their treatment plan is from their treatment facility. I encourage DV counseling, therapy, grief counseling, whatever it may be. I am normally in contact with counselors at their program leading up unto and even after. We don't have to be. I do that because my heart is very invested in this. Mind, body, and spirit. We encourage that. I have an in-home gym now for the women. We have an art room. We encourage all of this. And as far as the police department and fire department, I'm just going to speak for my house alone. Since April 11th of last year when I moved in, we have had the police called to the home twice. And that was myself who made the phone call, and that was to ensure the safety of one of my residents, as well as the rest of the residents in my home in the community. I appreciate every single one of you for allowing me the chance to save my life, because that is what I've been allowed in the sober house. And as far as the ambulance, I've not once had an overdose in this house since I've been here in April. The ambulance has come 3 times to this house. Twice was actually to pick me up after one, a seizure, and a serious concussion. I had medical issues. Remember, a lot of us haven't taken care of ourselves in years. Just because an ambulance goes to that residence does not mean it's an overdose. We have treated our bodies, you can imagine. And as far as the cars in and out, prostitutes and drug deals, if there's that amount of traffic, I guarantee you none of the above is going on in that residence. Honestly, it is more likely to be a neighbor or somebody who is so low-key. They don't want to draw attention to them. Think about it. I'm here without transportation. I have to get to meetings, to and from work, my doctor's appointments. I rely on other people for everything, to get to a laundromat, to go grocery shopping. If there is traffic, just be open-minded. It may be other things. I'm not discounting what anyone has said, but please, we're literally learning how to live sober, some of us for the first time ever. It's hard, and love and support, it goes a long way. Again, if anybody has any questions for me, feel free. I'd be glad to answer. Thank you.
Thank you.
Good evening. My name is Jimmy Dufilli. I'm an attorney over in Mashpee. I'd like to thank Madam Chairman and the members of the panel tonight for being here. I think this was an important meeting for the community of Falmouth. And I'd like to thank the residents of Falmouth and the surrounding towns. I very much sympathize with the property owners in the surrounding areas. And I don't think every single sober house is run correctly. However, there is an ample amount in the recovery community that are doing the right things. And I'd really just like to express my gratitude for the community of Falmouth, and not just the recovery community, but the citizens who exercise patience and care and understanding for members such as myself of the community who are not from this area, but like some of our past speakers have said, I really feel like this community has saved my life. I have almost a year and a half clean today. And last month, I was able to go, a year and a half ago, leaving detox without a car. In a year and a half, last month I opened the commercial property for my own law firm. And that's incredible for me to know where I came from. And specifically, to the relevancy of this meeting, I would not be here without my enrollment and long-term residency in one of these well-functioning sober homes. I know that, and thankfully I landed in one of the good residences. And I encourage you, if you do see these houses, which you feel are sober homes, knock on their door. I manage one of these houses. I love to speak to our neighbors. Any concerns you have, most of us are really trying to be high-functioning members of the community. I intend on putting my roots down here, and I really do my best to try to be respectful of all members of the community. So please, like many of our speakers have said, try to exercise some compassion, because I know each and every one of us knows or is related to someone who has been affected by substance abuse disorder. Thank you.
Just before we leave, I want to read the police log for the incident at the T-Ticket Sober House on June 1st. A woman at a T-Ticket Sober House overdosed on prescription medication in an attempt to kill herself. She was transported to the emergency room by the fire department, where she was committed for mental health reasons. Just want to make sure we had the facts out there.
Thank you. And I just wanted to thank all of you for being here tonight. It's really the beginning of a conversation. I want to thank all of the individuals here. Larissa and Derek, thank you so much for being here. To our board, our chiefs, our elected officials, folks from our departments, thank you for answering questions. And in particular, I just really want to thank folks in recovery. You're really doing the hardest work that humans can do. And then to get up and talk about it is just really the height of bravery, particularly knowing sort of the atmosphere that you are walking into. So thank you for sharing. It puts a face and a human touch to what we're talking about. Thank you all.